All right, just a few more seconds and we'll go ahead and get started here. See that there's still folks joining, so it's given one more minute. All right, well, I'm going to go ahead and get us started. I want to welcome everyone to NCSL's COVID-19 and Child Welfare series of virtual meetings. Today's program is the second in a 5-part series of an interactive virtual meeting series lasting now until August. And I am Donna Wilson. I'm a program director at NCSL's Children and Families program, and I'll be your host for today. We're also joined by my colleague, Nina Williams-Mbang, who is a senior fellow in NCSL's Children and Families program. And this series will highlight state and federal policy responses to COVID-19 in the child welfare system. Sessions will feature state legislators, legislative staff, sorry, I got tongue twisted, NCSL staff and other experts. Participants will have the opportunity to hear what's happening in other states, to ask questions, and to let NCSL know how we can best assist you during this time. We launched this series on June 10th with an overview of the impact of the COVID-19 pandemic and the impact that it's having on our child welfare system. The archive of this virtual meeting is available on our website, and the link will be shared on our NCSL's resources slide at the end of today's presentation. As I said in the first meeting in this series, we would be remiss to have this conversation about COVID-19's impact on children, youth, and families in the child welfare system, as well as the child welfare workforce itself, and not be mindful of whose safety and well-being we're talking about. Many of us know that a disproportionate number of children involved in the child welfare system are children of color, and these children come from families and communities that are now being hit the hardest by the COVID-19 pandemic and subsequent economic downturn. They're also the same families and communities impacted by the types of systemic racism currently receiving national attention. This is the context that we will frame our discussion today. Additionally, I want to point out that NCSL has collected more than 60 statements made recently by legislators on the issues of race. They offer guidance and insight into what legislative leaders are thinking and how they are reflecting on issues many policymakers believe need to be addressed. These statements will also be included in our resources provided at the end of our session today. We would like to thank Casey Family Programs and the Annie E. Casey Foundation for their support for this project. And today we're gonna do something a little different. We're gonna start with a video from CBS that summarizes some of the issues the child welfare caseworkers are dealing with. Then you'll hear from our 3 panelists. We'll hear from you through a polling question, and then we'll engage in a discussion with our panelists at the end. We'll ask to hear from you again by having you complete a short online evaluation. So before we get started and before I introduce our panelists, I just want to cover a few housekeeping items for you. If any time during this process you require help, we just ask that you refer to the Zoom cheat sheet that we sent to you before. If you happen to get disconnected from the meeting, you can simply go back and use the link that we sent you out or the link you used originally to join the meeting. And then I want to point out that we are documenting today's proceedings by recording the meeting, and that recording will be available on NCSL's COVID-19 child welfare webpage following this session. And we want to hear from you during this process, and so we're asking you to please use the chat box. We solicited questions before we began, but if you're hearing anything that comes up for you during this presentation, we're asking you just to throw your questions in the chat box, and we will do our best to try to answer those during the panel discussion. But if for some reason we can't get to those questions, we'll make sure that we follow up with you afterwards and provide you with the answers that you're looking for. So I also want to tell you a little bit about what you can expect for today, where our goal is really to allow time and space for you to examine the issues that are facing the child welfare workforce during this coronavirus pandemic, including the decrease of child abuse reporting, the lack of appropriate PPE or personal protective equipment, and the inability to directly engage with children due to suspension of in-person visits in states. And so based on that, we want you to have the opportunity to learn about state efforts to assist the child welfare workforce to really have workers be able to continue their duties during this pandemic. And so with that being said, I want to tell you who you're going to hear from today. We are joined by Dr. Mary McCarthy, who is a co-principal investigator for the National Child Welfare Workforce Institute at the University of Albany. We affectionately call that organization NICWE, so if you happen to hear that, that's what that term is. We're also joined by Representative Jonathan Singer from my home state, Colorado. He is the chair of Public Healthcare and Human Services Committee, and he was also an NCSL 2018-19 Child Welfare Fellow. And then we're also joined by Representative Tara Toohill of Pennsylvania, who is a member of the Children and Youth and Human Services Committees. And both of these legislators will provide perspectives on their efforts in their states to address concerns around COVID-19 and its impact on the child welfare workforce. So that being said, before you hear from our panelists, we are going to share this video with you. It's a short clip, and we hope you enjoy.
Yes.
Their unique challenges for child welfare workers.
Normally at this time, this waiting room would be full of families here to receive forensic interviews.
We are a juvenile detention facility. We house 12 boys, and we currently have 5 in-house. 7 are on extended home passes. The 5 that we have were not able to go on home passes because some of them actually don't have homes.
We usually have lots of toys, but right now we have nothing in here.
Whether working from home.
This used to be my kitchen table. It's now a desk. And then over here, I've transformed a little corner into where I can take my virtual sessions.
I had never done a televideo session in my life before a couple of weeks ago, and now is my whole life.
Or meeting with children in the field.
I feel really silly saying this, but I don't know which side to put against my face.
I'm outside right now because this is where I've met with some of my families over the last couple of weeks as we try to social distance.
I just finished up a forensic interview with a child, and now I'm going to disinfect this entire room, sanitize every surface that I can before we bring another child in here for a forensic interview.
Since COVID-19, we've had to come up with unique ways to forensically interview kids. We drilled a hole through the wall, ran Ethernet to our rooms. We have things jerry-rigged so that we can set up a safe process where our interviewer sits and the child sits, and they communicate via a video conferencing.
It's a challenge. We're doing the best we can with talking to kids about their abuse experiences via video conferencing.
It's really hard to try to talk about sexual abuse and extreme physical violence and watching a parent get murdered. I can no longer guarantee that what they say is going to remain confidential. And oftentimes they're sharing about the abuse that they endured in the space where they were abused. That's hard.
So we wanted to start you all off with that short video just to really frame some of the issues that we're going to talk about today. So we will make sure that we send you the link so you can view that full video at the conclusion of our presentation. You'll want to go and check it out. It's really rich with diary testimonies from these caseworkers about new issues and challenges they're facing amongst the COVID-19 pandemic. So as many of you already know, child welfare caseworkers are first responders. They ensure the safety, stability, and well-being of vulnerable children and families, as demonstrated in that short clip that you just saw. And This already challenging job is now being further complicated by the COVID-19 pandemic. And with many jurisdictions implementing social distancing mandates, the operating environment for child welfare caseworkers have shifted. And so I want to turn it over now for you all to hear from Dr. Mary McCarthy. And as she begins to share some information with you, I just want you to keep in mind to, please put any questions that come up as you're listening from any of our panelists along the way, because we will use those during our panel discussion. So Dr. McCarthy, it is all yours.
Donna, for the introduction, and to NCSL for hosting this important webinar series. I'm honored to share the microphone with two distinguished legislators from Colorado and Pennsylvania who are important leaders in their states in the area of children and family services, and I look forward to hearing from them. Today, I will briefly cover issues that the child welfare workforce faced and innovations that emerged from their work in the COVID-19 environment, which is dominated by uncertainty. In spite of the challenges, child welfare workers showed up every day to do their best to serve children and families and offer us important tips and strategies for how to continue navigating the current pandemic, including necessary preparations to ensure their ability to work effectively into the future. What I ask us all to keep in mind in a time with no precedent is the need to stay humble and recognize some important guiding principles around decision-making and leadership. We do not know what the right way is to do child welfare work in the context of a pandemic. So leaders need to be flexible and most of all compassionate towards their workforce and families. Leaders we work with are finding when they lead with these principles, their workers feel supported and capable of getting up each day to engage with the work ahead. Supervisors and managers must have the flexibility to think on their feet and make decisions to support workers and keep families and children safe. Legislators can be there to provide recognition and support for this heroic work. You must be partners in the long-term work to make sure the child welfare agencies have what they need to continue this work into the future. As Donna said, many states and jurisdictions, along with the Children's Bureau, quickly sent out guidance to staff about how to carry out investigations, maintain safety, and oversee visitation and placements as they moved rapidly to working from home. Despite guidance, there was still a great deal of confusion, uncertainty, and fear for everyone, workers and families. What we heard from the workers themselves is that many of them put fear aside to do their jobs, even with the uncertainty regarding what it would mean for their own families. There are so many aspects of child welfare work that required attention, some of which are topics for this series. I will focus on the following workforce issues: technology, supervision, family connections and safety, and future planning. Many jurisdictions were quickly able to provide laptops, tablets, and smartphones that could access record-keeping systems, so staff had connectivity to the agency and connection with each other. However, there was great variability in access to equipment across the country. For some jurisdictions, it took several days, even weeks, to ensure that all employees had access to computers or tablets and were able to log into a secure network. Workers may have been using personal phones without privacy settings or appropriate security. Workers that had tablets or laptops had to fund their Wi-Fi when working from home. These are critical infrastructure issues for states and jurisdictions that must be attended to. Access to virtual platforms for video conferencing was another area where agencies are still struggling. Which conferencing software will we use? Are there firewall challenges that prevent the interface with the software? How prepared are our electronic systems to maintain security and allow for use of video conferencing technology in their work with families, or to provide supervision and connection with our staff? When a visit's recorded, workers need to get consent and have a plan for securing these videos. Are they stored on a secure agency server on the laptop? What if workers use their personal cell phones with limited security? Agencies will be called upon to engage with workers to create the necessary security structures for ongoing virtual work. What do privacy agreements look like? What platforms can be used for what types of visits? Can workers use text and phone calls without giving out their personal phone number? Agencies will need to provide recommendations about what technology may be appropriate for different routine casework tasks. Sometimes the most secure options are difficult for families to access. So agencies and workers need to know what the laws and policies are regarding privacy and security, including the guidelines for relaxed oversight of HIPAA regulations during this crisis. One of the issues we heard about consistently from workers across the country is broadband access. It doesn't matter if you have all the right hardware and software that meets all of the requirements for confidentiality and access to records if there is no Wi-Fi. This challenge creates a hard stop to the work and requires infrastructure investments. Some amazing innovations related to this included school districts sending buses out to different communities as mobile hotspots. The district would notify the communities as to when the bus would be in their area, so families and workers and teachers could log in. Another innovation was libraries opening up their parking lots so families could park and use their Wi-Fi for a virtual family visit. Legislatures are the prime movers for assessing capacity and equipment readiness for their state. Every child welfare system in the country should be doing what business did over the past 5 years. Schedule a work from home week, the system capacity under real-time, non-emergency conditions, and then develop a plan to remedy any system or equipment deficiencies so business can be maintained in a crisis. Supervision and connection with staff. We heard from staff and child welfare leaders across the country that they were actually more in touch with each other once they went to remote work. Directors and managers held regular all-staff meetings or regional meetings to hear directly about their concerns and accomplishments. To a person, they want to continue these virtual staff conversations. We heard the same from supervisors who used meeting times to encourage and support their staff. Rules were tossed out and we were operating in a new environment. Managers and supervisors were able to ask themselves, what makes sense for going forward? And leaders supported their staff in making these decisions using the principles I mentioned earlier, flexibility and compassion. Some examples of innovations include focusing on self-care and resiliency every day, having virtual morning coffee to connect for the day, and then working together as a team to think about best approaches for client contact planned for that day, inviting workers to suggest effective schedules. Remember, many workers were also homeschooling their children. Encouraging people to take 5 to 10 minutes in between caseworker meetings and move away from the computer for a quick break. Reminding people not to work overtime unless absolutely necessary. Everyone needs time to disconnect. This is a crisis for everyone, including our workers. One gap identified by workers who had to go into the field was childcare access for their own children. When designated as first responders or essential workforces, finding childcare was very challenging in many communities. Safety and family connections. Safety is intricately tied to our ability to work with families. Workers and supervisors must be up to date on the safety guidelines and center the family in all the work. Child welfare leaders are thinking a lot about how to advise workers on protocols that build on our best understanding of safety and using technology in a way that does not interfere with maintaining relationships. Agencies implemented daily case conferencing to support efforts to maintain family-centered practice. Workers and supervisors worked together to develop a script for visits that would help normalize that visit. Remember, workers are juggling all the requirements of an investigation or foster care visit with handling technology, assessing whether anyone in the house is sick, wearing a mask themselves, and making sure they reassure the family, all while they're trying to gather accurate information to assess safety and risk. With the reduction in reports, workers talked about having more time to really talk with and listen to families. Because everyone was in a new environment, workers were able to be more honest about connecting virtually and that we're all learning how to do this. Families appreciated being asked for their assistance to set up visits or complete an investigation in a way that focused on respect and safety. When meetings happened virtually and workers were connecting from home, families appreciated the sense of greater equality and going through this pandemic together. There was actually less stigma and hierarchy. The key ingredient in all this work is communication. making sure we're talking with each other and listening to support thoughtful decision-making on a daily basis. The recent discussions about race and racism in America has opened new dialogue among staff and with families as well. There's more dialogue about the ways racism and discrimination impacts families and the child welfare system, and a new important openness to listening to each other. Many agencies are looking at ways to continue virtual visitation as a supplement to in-person visits when they resume. The virtual visits create opportunities for increased connection between families and children that can be better aligned with children's developmental stage. Across the country, there was a parallel process going on, centering the family and the worker as we learned how to deliver services safely in this new environment. We want to maintain this core value in the work going forward. For future planning, vigilance and attention to safety measures look like the order of the year as we endeavor to determine how best to carry out child welfare into the foreseeable future. We are now building the roadmap for how to structure investigations, visitation, court hearings, and family support services, and legislatures are at the center of the work. A few areas that we see for priority attention include technology infrastructure. If the majority of the work will be taking place using technology, agencies must have the ability to provide equipment, have tech support available to train staff and troubleshoot, have access to Wi-Fi for all communities, and develop practice guidelines for courts and agencies that recognize this new reality. Legislatures must look at laws that limit the ability of child welfare to operate in this new way. Funding must support this critical infrastructure need in a way that does not jeopardize service delivery, which is likely to be a big challenge. We're hearing from workers that there is strong interest in blending work from home in the office with access to appropriate technology into the future. Safety protocols must be in place to protect workers and families. Agencies must put in place return to office plans that include timelines for this and options for continuing to blend working from home and office. We must monitor the impact of COVID-19 to ensure we are learning as we go and immediately modify practices to support safety. This is an opportunity to apply a race equity lens to our work going forward, as we recognize the shared vulnerabilities and also greater awareness about the disparity that COVID-19 has uncovered. Both workers and families need access to PPE, water for hand washing, and soap and sanitizer for cleaning. They must have housing and employment stability to ensure a safe environment for their family. How are we balancing our social responsibility for reasonable resources that allow parents to keep children safe? Families and communities need support more than ever in areas like income, employment, childcare, access to health care, domestic violence services, and neglect aversion. So let me talk for a minute about neglect statutes and reporting. With so many people out of work and unstable housing, few resources for food, utilities, and rent, how will we respond to reports of neglect? Is this crisis the opportunity for reevaluating child neglect statutes in our states? While there are some commonalities across all states and their statutes, there are some noteworthy divergences. It invites us to ask ourselves some questions, like should we be paying more systematic attention to poverty interventions and related prevention supports needed by families? What are the essential prevention supports needed to be successful at parenting? There are many programs that have demonstrated the effectiveness of these interventions that could form the basis for a retooling of our service array to divert families from a CPS investigation. The impact could be significant since the national rate for reports of neglect is 60.8%, with only 17 states below 50% for neglect reports. One of our NICWE leads is working on an analysis of neglect statutes nationally that will be shared with NCSL and published soon. We are working to compile the innovations that we heard from across the country, and these will be available on the NICWE website. We're also finalizing the analysis of a survey on COVID-19 from our 7 workforce excellence sites. The summary of the findings will be sent to NCSL, and they should be out very soon. Our webinar series supporting the virtual workforce was attended by more than 17,000 people and is available for viewing on our website. Information is listed on the resource document prepared by the NCSL staff. We appreciate the opportunity to join you for this meeting and look forward to continuing to gather and share information that supports the workforce into the future. Thank you.
Thank you, Dr. McCarthy. There were some times where your voice sort of went in and out, but we're hoping that because this has been recorded, if we need to go back and ask you for any specific bullet points, we'll definitely do that. But the information that you provided was rich and vast, and I can't wait to dig into some of those things that you shared during the panel discussion. So thank you. At this time, I'm going to turn it over to Representative Jonathan Singer, who is outside enjoying the Colorado sunshine, and I'm going to turn it over to you, Representative Singer.
Oh, thank you, and thank you all. I didn't know I could fit all of you in my backyard. This is pretty amazing, and I'm putting on the headset because I'm always conscious of not wanting to expose my neighbors to all this policy work that I love to nerd out on, but may cause other people a little bit of concern. So before I start, I just wanted to, I'm term limited. This is my last year at the legislature. We just finished our session about a week ago. And I want to say that NCSL has been a remarkable resource for me. As somebody who started out as a caseworker doing child welfare work, I would have never expected to be serving in the Colorado State House at the age of 32 and then working on landmark legislation that I'm going to talk a little bit about. But really, Nina, you've done a phenomenal job bringing people together through the Child Welfare Fellows Program. Even if you aren't involved in the Fellows Program, show up for these things. This is the most exciting, nonpartisan work you can do. And as one of my, as the vice chair of my vice chair of the Human Services Committee puts it, kids in foster care are our children. We talk a lot about this in politics, right? Who are, we're doing this for our children. Well, who are really our children? It's the kids that we've decided are no longer safe with their parents for whatever period of time. That's our responsibility. And if we don't treat those kids like our own, we're failing. And so this is, so I want to say thank you to NCSL for what they've done, and thank you for sharing that link. I'm going to do a quick question for everyone, and I know we're going to do polls later, but I always like to get folks a little involved. So if anyone who wants to, if you click on the participants button, you'll have the opportunity, if you click on participants, there's on the bottom right-hand corner, once you click on that, there's a thumbs up, there's a thumbs down, and then there's clapping and some other images. I'm just curious, how many people on this Zoom conference are either legislators or aides in the legislative branch? If you want to give me a thumbs up for that, because we all love government here, right? And I'll give folks a second. I'm seeing a few thumbs go up, a few check marks. How many folks, you can go ahead and put those down. How many people are in the executive branch? And you can do thumbs up for that. You don't have to give thumbs down, even though we know as legislators, the real enemy is the executive branch. So, all right. So thank you. That's always just helpful to get a little perspective of things. We had a series of questions that were asked of us, and the Colorado Department of Human Services helped me answer some of those questions. But I'm going to talk a little bit about the process that got us to some of these questions. So, the first one, we were looking at, caseworker burnout, and the fact that we know that about every 2.5 to 3.5 years, we see caseworker turnover. That costs our state sometimes upwards in the neighborhood of $300,000 to $700,000 a year, every year in new workforce training. In a state supervised county administered system where we are a low tax state that has to constitutionally balance our budget, that's a real strain. We also know that we did some research that said that every time a caseworker turns over, the likelihood of a child remaining in foster care or congregate care increases, and sometimes on average, those kids stay in foster care an additional 7 months. So there are some major changes that we need to do. And so what I'm going to do is share with you about 4 links in the chat section that talk a little bit about some of the things that our legislature has done, almost all of which unanimously, and almost all of which were done by myself, a Democrat, and then also a Republican from the other side of the aisle. We worked together on these issues. And so I'm going to put that in the chat section right now. And just talk a little, and it's going to start out with a workload study, and it's just a fact sheet that you'll see. It's a one-page fact sheet, and you can look at that instead of my face, which is always a step up. So what this was, and I encourage your state to do this, is to not just look at what's going on in terms of your caseload, because caseload numbers are going down right now, but you need to look at the workload. And there's a big difference between a kid coming to school without shoes on and maybe needing some social supports, or the family's needing some economic support and job coaching, and a kid with a brain bleed or a serious fracture or a house with 6 kids and a meth lab in the basement. Each of those are one case, but one does not equal one. So what we did in 2014 is we created a workload study where we did a point-in-time study for 4 weeks in 54 of the 64 counties we have in the state of Colorado to really look at what are our caseworkers doing, what's taking the most amount of time, and what can we do about that. In rural areas, a lot of times it had to do with travel. In more urban areas, it might have been dealing with documentation in our statewide child protection database. But out of that, we understood that we were 700 caseworkers and supervisors short in our system. That was back in 2014, 2015. The governor at the time said, I can't buy 700 caseworkers, but I will get you 100 caseworkers per year for as many years as I'm in office. It was a remarkable first step and first start. This year was the only budget year we didn't add new caseworkers, and that's because of our COVID budget crunch, frankly. But what we did accomplish was we have now a footnote sitting in our budget. So next year, when we are examining our budget again, we understand that we're still about 254 caseworkers short of where we needed to be 6 years ago. So take a look at that workload study. I really encourage you in different states to find ways to reproduce that workload study and use even this COVID crisis as a guide, because while caseloads may be going down, the work may not be. There were also some questions about resiliency in our workforce. How do we invest in that? So we passed a bill in 2017. Once again, it was a bipartisan bill that created a task force of frontline caseworkers, administrators, county commissioners, all coming together saying, what's going on that caseworkers are turning over? Is it low pay or is it something else? And, you know, caseworkers don't go into this for the money. We already know that to begin with. But when they need time off to go see a therapist, or as we see in law enforcement, some of the successful things we've seen in law enforcement, like peer support groups to help retain our law enforcement officers, we weren't seeing that in the child welfare system. So every county, because we're a county administered system, has taken that information and used it differently, and that's a good thing. But I would really encourage you to look at a resiliency, once again, a resiliency task force to put your ideas together and bring those caseworkers to the table. I would have never thought that the number one thing that a rural caseworker needed was 4 hours off once every other week so they could go see a therapist in another part of the state that wasn't the same therapist for their families that they were taking care of. And, you know, there was a question about whether or not our system in Colorado classifies caseworkers as first responders. And the short answer is no. But what we have done is we've actually passed 2 caseworker privacy bills. Once again, these are in the chat section. One last year, one this year. After an informal study that turned into a formal study was done in one county where they discovered the egregious levels of threats that we saw against caseworkers. People being doxxed online, angry parents stalking caseworkers, sending caseworkers pictures of their own caseworkers' family members. And what we did is we said, just like DAs and judges can keep their names off of public record, we're going to extend that same ability to our child welfare caseworkers. We did that in 2019, and then we actually took it a step further in 2020 because child support workers came to the table and other folks and said, you know what, we're getting the same level of death threats. We're seeing the same level. And they go, look, I went into this work to protect families, and now my own family is being threatened, being put at risk. And so
Hey,
these
Rep
are all
Singer, I'm just going to give you the 1-minute warning.
perfect, because this is a great segue. So these are all the opportunities that I would suggest in terms of hard takeaways that that you can do to implement these things in your state, in your way, through legislation, through executive order, through rulemaking, you name it. But this is your opportunity to do that, and I look forward to seeing what other questions you have. The last thing I'll mention, actually, that I completely forgot about is we have a Child Protection Ombudsman's Office. They are a separate third party outside of the executive branch, and they were the ones that actually got us the PPE to begin with. And now we're making use of Chafee funds. And so I'll leave a link in the chat section for that, but please just thank you for your attention, and I look forward to seeing where the conversation goes next.
Thank you so much. I'm not sure how this happened, but somehow we managed to get just a little bit behind on our agenda, but that's okay. Thank you so much, Representative Singer, for sharing all the efforts that Colorado has done in regards to workforce response to COVID-19. We'll have some additional questions for you during the panel. I'm going to turn it over now, though, to Representative Tara Toohill from Pennsylvania. So we'll turn it over to you.
Thank you. Yes, Donna. And you always say my name right, so I appreciate that. It's hard to spell and hard to pronounce. Hello, everyone. I'm very grateful to have been invited today to participate. I've been in the legislature 10 years. I'm the vice chair of the Children and Youth Committee here in Pennsylvania, and I'm a former foster mother. My children are adopted, and I grew up in a home where my parents were foster parents to over 42 children. I was the only biological child, and so I have adopted siblings. And my life has been very involved in the system, but you know, it still has taken me 10 years to really get a grasp and get laws moving here in Pennsylvania. Unfortunately, I know many of you as legislators are pulled in a lot of different directions, and we have to be a jack of all trades. And so it's unfortunate that Representative Singer is term limited because that knowledge that he has, that historical knowledge that from his time as a caseworker is just very apparent in the great strides that he's made. So I thank him for that. I took copious notes on what he was talking about, so I can see if we can implement some of those items here in Pennsylvania. As we all know, COVID-19 has greatly disrupted childhood. Here in Pennsylvania, we have had about a 50% reduction in child abuse reporting. And that is probably the same in many of your states. Here we have educators are the #1 reporters of child abuse and neglect, of suspected suspected abuse and neglect. And healthcare workers, including doctors and pediatricians, those healthcare professionals are the #2 reporter. So we have children largely disconnected with the childcare providers, teachers, school nurses, clergy, and this is going to continue now that we're looking at 2 more months of this vacation, of this shelter at home, 2 months now of school vacation, and then the problem of how children are going to be back in the classroom in the fall and for how long that lasts. So we do have some issues here that we're facing, and many caseworkers are coming forward fearing that we are not really seeing all of the child abuse and neglect until really in some cases it's too late and they're fatality cases, or that the neglect has become so severe that there's hospitalizations. So we fear that a lot of this is still going undetected due to the limited amount that children are in the general public. On April 16th, the United Nations Secretary General did a statement elevating awareness and talking about family stress levels rising and children as being victims and witnesses of the growing domestic violence and abuse and also that children are more vulnerable to online exploitation right now during this period, and grooming, as well as a lot of cyber bullying and violent content exposure. And those are items that caseworkers are going to be seeing maybe a growth in here. Like Representative Singer, Pennsylvania is state supervised only and county administered. So the complaint that we've had from caseworkers is that this supervisory role of the state that's more hands-off, handing down guidance, and less boots on the ground involved, that has really disrupted our state from being able to properly address and work quickly during this pandemic. So we already had a system that was broken and had a lot of many systemic issues, and now the pandemic has added to that. We had a shortage of foster parents. That is even more so the case now. Foster parents are hesitant, people are hesitant to come forward as foster parents, open their homes, risk exposure. There's still a lot of fear associated with COVID-19 exposure and having people in your home, and taking in children or even getting approved as a foster parent. We're short on caseworkers, and a lot of them are vastly underpaid. And I have a bill, Donna is going to make the links available. We have House Bill 1980 I've had for some time that encourages workers to enter the field with student loan forgiveness. And I'd encourage you to share any of this legislation. The PPE item that Representative Singer spoke about with his ombudsman, we just got an ombudsman in Pennsylvania, a state child advocate, and that's something that I'm going to be exploring, as well as the designation of caseworkers as frontline responders. And we have one of our items here in Pennsylvania, we had, and many of you would have this issue as well, is children that are in foster care, that are these older transitional youth aging out during the pandemic. So if you have a family support system, you were able to come home from college to your family, lose your job, and come back to a family that would say, yes, live with us, and we'll help you. We'll help you fill out pandemic unemployment assistance. Come and live with us. It's okay that you don't have a job. And older foster youth do not have that support system, especially if they're supposed to be transitioning out during this time. So we had 65% of these older transition youth who lost employment, and half of them, we had 65% that were working before the pandemic lose their employment, and half of those who applied did not receive assistance. We also had nearly 1 in 5 of those older youth had run out of food when we surveyed them. We also had 23% of young people reported that they were forced to move or fear that they would be forced to move out of their current living situation. So we've been working with our colleges regarding housing, any housing they might have available during the summer months now. And 37% reported having a family member they could rely on, but 1 in 5 of those youth said that they were completely on their own. So other states had passed executive orders in order to cover these youth. And I have a House bill, Donna Wilson, I sent it to you. I'm not good at screen sharing, so.
That's okay.
But Donna,
I'm just gonna ask one more minute. I just wanted to let you know that as you're sharing some really good information. But yes, we have all of that, and we will make sure that we share it at the conclusion.
Perfect. Perfect. Thank you, Donna. So we, interestingly, our governor in Pennsylvania, he did many executive orders, many that have been arguably reaching, but we asked him to do an executive order for a moratorium on aging out of foster care during a pandemic, and he has declined to do this executive order. So we do have a piece of legislation. Ohio, Alaska, California, Rhode Island, they did executive orders. And if your state has not addressed this, you may want to, and I'll help you if you contact me, you may want to look into the CARES Act funding that went out to the different counties, that some of that money can be used, and encouraging your children and youth, your welfare services to offer extension to these older youth that are aging out. And just in closing, you know, I'm looking forward to working with all of you in the future to have a more cohesive child protection and child welfare system, and looking at policies throughout the nation, and having it be more cohesive for all of us, and helping each other, because it is a very difficult area. But thank you to NCSL. This has great potential for positive change for children out there today.
Yeah, thank you so much, Representative Toohill. I mean, you all shared some really rich content, and I'm going to turn it over to Nina really quick to do a quick poll of our participants, and then we're going to dig right in. I apologize, I don't know how we got behind time, but it's going to limit the amount of questions that we're able to have you all dialogue on, but we're gonna do that quickly. So Nina, I'm gonna turn it over to you to do this poll, and then we're gonna go quickly into our panel discussion.
Great, thank you, Donna. The poll is right there in front of you. I will read it. Was your state able to quickly provide tablets, cell or smartphones, internet access, and other equipment and technology to workers to allow them to respond to safety concerns and families' needs during the pandemic? Please select one from the choices below. Cell phones were provided, cell phones and laptops were provided, cell phones, laptops, and other equipment were provided, or workers could still benefit from receiving this equipment, or I do not know. We're getting the responses in. It seems as the majority of respondents said that they do not know what type of equipment. Next, cell phones and laptops were provided. Thank you for participating in the poll.
Thank you, Nina, for gathering that information. And I'm actually just going to start with a question that talks about that for our panels and for our panelists. So the question is, how can legislators assist with providing caseworkers the necessary PPE? I think you all have mentioned this. This isn't the end of COVID-19. You know, although states are, you know, starting to open slowly, there's still a need for our workforce to be equipped with equipment and also to be protected. And so how do states pay for this in this tight budget time?
Can I jump in real quick?
Absolutely.
All right. So this is what I know. So the Children's Bureau released new guidance recently allowing for the use of Title 4B and I mentioned before Chafee funds to assist with purchasing of cell phones, cell phone plans to facilitate and maintain family contacts and court contact. Also purchasing PPE as an allowable cost. And so, and then I shared a link about what the Office of the Child Protection Ombudsman did to just get out of the gate on this as well. So I would definitely take a look at the federal guidance and reach out if you need any other information on that one.
Thank you so much. Anyone else on the panel want to add anything additional, or can I move on to another question? Okay, I'm making heads nod. So how has your state, Representative Toohill, you brought this up, and Dr. McCarthy, you also talked a little bit about this as well in terms of the decrease of child abuse and neglect reporting right now. So the question is, how has your state addressed mandatory reporting during the pandemic? And, you know, you all have already talked about, you know, in Pennsylvania, you've seen a 50% decrease, and there tends to be this assumption that once kids are back in school or, you know, back on the eyes of pediatricians and educators, we're going to see this huge influx of cases. And I'm just curious if you all have had any conversations or practices around how to handle that, or what your thoughts are. You know, all three of you, really, I want to hear your thoughts on how we either dispel this myth or respond to this notion of this increase. I know, Dr. McCarthy, you talked a little bit about, you know, warm lines, that sort of thing. So I'm going to pause. Hope you got that question and see what your thoughts are on that.
This is Tara. I can address a little bit of it. With what we've done in Pennsylvania, we actually have a lot of different lines that you can call. Our Secretary of Health and the governor, they were doing daily briefings. So we asked them to just tack on a public service announcement and try to do public service announcements that were helpful, since they had, you know, mass viewership going on. That even talking about, you know, how to calm a crying baby, shaken baby, we've seen a lot of those cases. You know, calling the warm line. We have a warm line and a information line, and the warm line is supposed to be confidential. There are some issues, I guess, with it. If there's something really abuse related, that then that would end up getting used against the caller, but people aren't really aware of that. And talking about child line all the time, it's called child line for us, when what you call in for, that really just public service announcements. So there should be so much more. Most of it is organic, like a county doing Zoom support groups for at-risk families, or nonprofits doing support groups. But you know, respites, making respites available, especially grandparents that are out there raising grandchildren, that they have 6 grandchildren in a house. I mean, we have some really tough situations that families are not getting breaks from, or assistance with. So just trying to push those, and I think we really need to have a call to action over the next 60 days if we're going to be home states.
Thank you. And anyone else care to weigh in?
I'd just like to add that I think in many states, April, May, and June are usually the months when teachers file a lot of reports, when school districts file a lot of reports as school is ending, particularly related to attendance. So if you look at patterns over 10 years, we see that pattern anyway. So I think the reduced reports in the summer is not as unusual. But what it does is, we know that teachers, of all the mandated reporters, are the largest group of reporters that there are. And so I think we have to ask the question is, how are we working better as communities with schools and families to really provide the kinds of supports that families need to parent effectively? And some of that could be economic supports. Warm lines, I think, are another great example. What we're hearing from parent advocates now is that families are actually coming together and helping each other. So will we see this increase in reports? We don't know. If the pattern continues and teachers continue to use child welfare as the place where they call, and there aren't other service opportunities available, we probably will see an increase in reports. But I think it gives us a chance to reset and ask ourselves, are our neglect statutes the way we want them? Are they really bringing into child welfare the kinds of cases that should be in child welfare? If the average neglect reports across the country are 60.8% of all reports, do we really need to rethink, is child welfare the place where neglect reports belong? That was not its original intent in the original legislation. And so is this our opportunity to really reset how we're thinking about supporting families as opposed to reporting families?
That's really good. And I actually want, I want to segue off of the last thing that you just said, Dr. McCarthy, and just really allow you each 1 minute to just answer this final question, which is, how does the pandemic provide an opportunity for us to build back the child welfare system better? And you're already unmuted, Dr. McCarthy, so I'll let you start us, and then I'll hand it off into the order you all spoke, if that makes sense.
Oh my gosh, I can think of so many things and I have a minute. But one of the things was connection. We heard across the board that leaders in child welfare felt more connected to their workforce than ever before. What a beautiful thing, right? People were talking to each other instead of just passing each other in the hall or running into the bathroom to catch in up with each other. They were having real conversations. So that would be one thing. Let's maintain those connections between our leadership and our frontline workers. And then the other thing is our child, who needs to be in child protective services? What should the main focus of an investigatory child safety and risk assessment system be? And what do we do with families that just need a little extra help, a little extra resource, a little extra support to be good parents? And maybe we can find a better way to retool so that we're hitting both ends, the need for safety and risk, the need to protect kids and help families, and then also the need to support families.
Thank you. Representative Singer.
Yeah, well, this is an easy one to answer in a minute. It's right up there with figuring out world peace. What I would say is, the Families First Prevention Services Act has provided us with a new opportunity to look at prevention measures and figure out what those look like for each of our states. Colorado has historically had some of the highest child care rates in the nation. Child care on average costs more than rent or even a mortgage. And so when we're talking about stresses on families, this is an opportunity to take a holistic look at where we are with workforce development, childcare, and taking it a step back in a way that we are actually able to draw down federal funds. And so, that's one thing I'm going to be looking at is what we can do around the childcare issue, especially because I don't think our schools will come back to full time right away in September, and a lot of families will be looking for that. And we should have been dealing with this years before. So I'll leave it there.
Okay, thank you so much. Representative Toohill.
Thank you. Just to piggyback off of the Family First Prevention Services Act, Pennsylvania has actually delayed their application for that now it's going to be almost 3 years that we keep extending the deadline. So a special seminar on that, I think, would be really helpful for states to properly target what we want to fund and the type of services like have nurses go in, nurse-family partnerships, specialized childcare. There's so many things we could be doing to keep families together rather than throwing them into the child welfare system as a whole, as Mary was talking about. So I think that's part of it, the proper diagnosis. When you get these cases of whether a family falls into a child protection bucket or a general services. And so many families, if you have mental health and poverty, those families are supposed to be receiving different types of services, not losing their children and bogging down the system in that way. We're supposed to be doing a more holistic approach and helping them all together. And I just think this whole pandemic has really brought to light where we are broken when children, we have these really high at-risk families, and we know who those families are, and there's ways to identify these red flag families. And I think that we don't do enough to look at that. If the counties are so overwhelmed with their cases, and then we have the state up here, there's ways that we can really protect children, and we're missing the boat on that. So child protection and these really egregious cases, even linking animal abuse. There's animal abuse cases, things that are overlooked, or allowing police to better identify child abuse, and just following through on it. So there's so much work to be done. And I do think the pandemic has really brought a lot of that to light, that different ways that we could be working and tackling these problems.
Thank you all so much. I'm going to quickly turn it over to you, Nina, just to wrap us up. I apologize that we are right at time. So Nina, I'll turn it over to you real quick.
Okay. I want to thank all of our wonderful panelists for discussing the challenges that the child welfare workforce is currently facing and providing information on how lawmakers can support the workforce during and past the pandemic. You see here all of our resources, our general NCSL COVID-19 webpage. There's human services. We have child welfare resources related to COVID-19 online, information on the Family First Prevention Services Act, lawmakers' comments on racism and legislative statements on racism as well. And I want to remind you all of our next virtual meeting, and I'll get back to, I'm sorry, there's more resources here from the National Child Welfare Workforce Institute, including their webinar hosted by the Quality Improvement Center, information on workforce by the Child Welfare Information Gateway and the Children's Bureau COVID-19 resources. And coming up Wednesday, July 15th at 2 p.m. Eastern is our next Zoom virtual meeting, Understanding the Needs of Foster and Kinship Caregivers in Child Welfare. I hope that you will be able to attend that. Next up, we should have a really quick online evaluation. If you could take, please, just a few seconds to respond. This will really help ensure that we present useful and informative programming for you in the future. There are about 10